Did you hear about this story coming out of Ohio about a nurse charged with manslaughter? I was completely shocked when I heard about the story. The first thing I thought is another story about a nurse, negative in the news. But then I looked a little deeper into the story and I have questions. I actually have a lot of questions. So this is a story coming out of a rehab facility where a patient entered for a few probably days or weeks to get rehab and then return back to their own home. Unfortunately, this patient passed away on Christmas Eve. The patient was last seen at 8:40 p.m. for some medication. It was reported that the patient was speaking normally and sitting in a wheelchair. Then, at around 9 p.m., a handoff took place and another nurse, a different nurse, assumed care of the patient. This nurse went to go check in on the patient around 9:30 at night in her room and noticed that the patient was not in her room. So this nurse thought, well, perhaps the patient is with their family. It's the holidays, maybe they took her. The nurse went to go look at the patient visitation logs, and there wasn't anything to indicate that anyone had taken her out of the rehab facility. The next thing we hear is that around midnight, around 12:30, this nurse called the brother several times and was unsuccessful, no answer. So it wasn't until much later, around 6:30 a.m., that this nurse did report the patient missing, and in their facility they issue a code purple for a missing patient. So code purple, they sweep the grounds, and to their utter dismay they found the patient on their back in the patio. And again, this is happening in Christmas, it's really cold, it's snowing, and the patient did perish from hypothermia. The CPR was unsuccessful. The police were called at about 7:30 morning. This nurse told police that they are a new nurse and they didn't know what to do. So now this nurse is charged with manslaughter and 2 misdemeanor counts. One is of tampering with evidence because the nurse did chart that around 11:55 p.m. some kind of medication was administered to the patient. And the second misdemeanor charge is of gross negligence. Now, the facility, they say that their requirements are for patients to be checked on every 2 hours, that they do have a missing patient protocol in place, that they have alarms on every door, and that new nurses to the facility are trained for 4 weeks. But what I find really interesting is, why didn't the alarms go off? And did somebody turn the alarm off? Because that seems to happen a lot in facilities where alarms are silenced or turned off because they're going off too frequently. The other thing I would want to know is, what is the nurse to patient ratio? I would like to know what else was going on that was taking the nurse's attention away. For example, was the acuity load pretty high? Was the patient load pretty high? I also would want to know what other staff is in place that also does patient care. You know, in hospitals and other facilities, they have different staff members, not only nurses, they have techs, they have patient care assistants, nursing assistants, they have med techs, dietary people that come and deliver food, sometimes janitorial staff. And in many cases in facilities, it's common for people to alert someone if they see something gone awry. So this got me thinking about, what is neglect and how is it viewed in the eyes of the law? Well, it's important as nurses that you and I, whatever state we're practicing in, we're looking at the Nurses Practice Act and what it applies to us. And do you know your hospital or organization or facility's protocol on what to do if there's a missing patient? I've had patients gone missing. I've had patients elope. Working in an emergency room setting and also in a recovery room, it's common for people every once in a while to go missing. Now, I knew what I had to do, which was to tell the charge nurse, alert the nurse manager, notify security, call the police, fill out an incident report, and issue out whatever code for whatever organization I was working in. So It's important that you know what your responsibility is if ever a patient goes missing. So for a nurse, neglect is a failure to do something, a failure of care, a failure to provide care, and it results into harm of the patient. So it focuses on what nurses fail to do rather than any intentional harm. What are some examples? Failing to administer medication at the appropriate time or as prescribed, monitoring a patient's condition adequately, providing necessary hygiene and care like bathing and grooming, responding promptly to patients' needs, whether they're in pain or any requests for assistance, failure to prevent falls or injuries, and failure to report any patient changes to a physician. So as nurses, what can we do? Well, you and I can do much more patient rounding. What I'd like to do at the start of my shift is round on each one of my patients really quick, just a 1 to 4 minute check-in, introducing who I am and letting them know that I'll be back. That way I can have eyeballs on each one of my people before I start getting into the weeds of going into the chart and seeing what other tasks and interventions need to be done. And having a good shift-to-shift communication or bedside handoff report, you can let the next nurse know this patient has some wandering tendencies, and then really explain what those wandering tendencies are. Oh, they're frequently getting out of the bed, or they're frequently asking to go home. And then you, as the next nurse coming on, you can ask, hey, does it seem like the patient has any urges to want to leave or elope out of here? What have you seen? As far as patient safety, you want to check that all the proper fall precautions are in place, whether it's socks or bed rails. I know that there's a limit on having all 4 bed rails up in some facilities, so you want to check your hospital facility guidelines on what's considered a restraint, whether all 4 bed rails are up or just 2. Are you aware of how to turn on a bed alarm for a patient that leaves the bed? And my tips for nursing students, it would be to tell you, are you familiar with what is neglect? What is the ethical considerations around patient care? And just thinking about how you can learn more about fall precautions and understanding your role even as a nursing student, as a patient advocate. If you're noticing something a little bit off with the patient, they're tending to wander around a bit more, or they don't seem as cognitively aware as they once were, who do you report that to? Is that going to be your preceptor? Is that going to be the nurse that you're assigned to? Is that your instructor? Feel comfortable with talking to the secretary at the station, the medical secretary, or the front desk person if you can't find your immediate preceptor person. And it's always important to learn how to do proper documentation about that you saw the patient in bed. And rather than just putting subjective data, write down data objectively that, say for instance, I entered the room, noticed the patient was attempting to get out of bed with the legs hung over the bed and arms pushing them to stand upright without the use of any assistive devices nearby them, and nurse notes that there is an order for patient to use assistive devices at all times. And if you're a loved one that has someone in a facility or in a rehab, be sure that you check in with the facility. Visit frequently the facility to check in on your loved one and feel comfortable with asking questions. Asking the care team if there's any changes in care, any changes in behavior. When looking for a facility, you might want to ask questions like, what is the nurse to staff patient ratio here? What are the qualifications and experience do these facilities have of the staff working in there? Facilities. Is there a registered nurse? What specific activities and services do they offer? Like physical rehab, physical therapy, occupational therapy, dietary services, speech therapy services. You'll also want to ask about any social and recreational activities the facility has so that your loved one can continue to be engaged in the community and presence with others to help break up the monotony of the day. You may want to ask the facility, how do they handle their medications and what do they do in case there's a medication error. You'll want to ask about ways to stay informed about your loved one's care in the facility. You'll want to ask about what measures they have in place for their patient safety. For example, Do they use bed rails, fall alarms, bed alarms? Do they have the use of assisted devices, hand railings? What systems do they have in place for preventing wandering? What security measures do they have to prevent theft? What alarms do they have on the doors, and are they able to be turned off and disabled? Another thing that this facility didn't have was security cameras, so you might want to ask about security cameras, or is it possible to bring your own security camera? These are just a few little things that I thought of that might be helpful to all of us when we're thinking about rehab facilities and hospitals, when I'm thinking about job security for yourself or myself. These are the things that are always running through my mind. I hope this is helpful, and remember, neglect is a failure to provide care rather than intending harm. So keep that in mind and be well.